Have you ever experienced that feeling of getting dizzy when you stand up? Well, this woman has, and she has to be very careful when she stands up because she has orthostatic hypotension, which is an excessive blood pressure drop after standing up, which may lead to low brain oxygen levels and to falls. So orthostatic hypotension is very strongly related to falls, which may also lead to hip fractures, hospitalization, and mortality. And it is very common. About 10% of all adults above 65 years have it, which comes down to about 10,000 individuals in Amsterdam alone. So that we know that in the group with orthostatic hypotension, 73% more people fall than in the group without orthostatic hypotension. However, when we try to estimate the individual's fall risk just based on the blood pressure drop after standing up, that estimation is really poor. That's why we think that you should not only look to blood pressure drop after standing up, but also to how this is compensated for by the heart and the brain, in order to improve this individual fall risk estimation to be able to personalize medication. So let's first have a look at the brain. Here you see a brain from below with the arteries supplying the brain with oxygen. And these arteries have the specific property that they can dilate if blood pressure drops in order to keep blood flow and brain oxygen levels constant. However, this compensatory activity of the arteries is not the same in different brains, as different brains are already very different from the outside. So that's why we have to really measure the individual's oxygen supply during standing up. And we can do that using this technique which is called NIRS, Near Infrared Spectroscopy. It's a very easy technique, simple to use, and you can apply it just to the forehead. And you can use it to measure it during standing up. It works based on light. So how does it work? NIRS sends light through the skull into the brain and measures the amount of reflected light. It does so at two different wavelengths, and the ratio of the detected wavelengths tells us the brain's oxygen level. So, in summary, I think that we should not only look to the blood pressure drop after standing up, but also to how this is compensated for by the brain's arteries, as measured using this NIRS technique, to really improve this individual's fall risk estimation. So that was the brain. Let's now have a look at the heart. The heart can also compensate for a blood pressure drop by increasing its heart rate, thereby increasing oxygen supply to the organs. And many organs are important, but muscles are especially important, particularly the core muscles, as they have the task to maintain standing balance and prevent falls. So you can imagine that if heart rate fails to increase adequately after standing up, this muscle may not get enough oxygen and falls may be the result. So in summary, we think that we should not only look to that blood pressure drop after standing up, but also to the compensation by the heart, so the increase in heart rate after standing up, to improve that personal individual fall risk estimation. So what can we do with this knowledge? I believe that we have to measure blood pressure and brain oxygen level using NIRS, and the heart rate using ECG during standing up in individuals. And thereby, and we did it in healthy adults just to prove that the concept works. And we measured 34 healthy young adults, 34 healthy older adults, and showed that the measurements are reliable. But we also wanted to see whether there were differences between those age groups with regard to compensation by the brain and the heart. So we looked at decreases of brain oxygen levels, and we did not see significant differences between the young and the older age groups. But what we did see is that the variance in the older group was really large, indicating that there are good compensators and poor compensators in this group, which I think is really interesting looking forward into. So when we look to heart rate compensation, we see that the younger group is able to increase heart rate much and significantly more than the older group, indicating that heart rate compensation after standing up may already decline with age. So these were results in healthy adults, but our goal is to do this fall risk estimation in these vulnerable mobility impaired adults. And these measurements we are doing right now to do this personal individual fall risk estimation. And if we have that fall risk, what can we do with it? How can we intervene? Well, I think there are many different options, but the main opportunity is to personalize blood pressure medication. Many older adults use blood pressure medication, and that blood pressure medication lowers blood pressure. But if we know which patients are at increased fall risk due to orthostatic hypotension and a poor compensation by the brain and the heart, we should really reduce this blood pressure medication or even stop it. And by doing so, we can be sure that we really minimize fall risk, not only for this woman, but also for the other 10,000 Amsterdam individuals at risk for falls due to orthostatic hypotension, and thereby really increase their quality of life.